Vaginal discharge. It's universally common, it's deeply biological, yet for some reason it's something we usually only talk about in hushed tones. Well, not today. In this explainer, we're going to decode exactly what your body is trying to tell you, separating everyday, completely normal bodily functions from the actual warning signs you need to look out for. All right, let's get right into it. Okay, let's dive into this. If you've ever noticed white discharge and silently wondered to yourself, wait, is this actually normal? Take a deep breath. You are absolutely not alone here. It's a completely shared human experience. Far too often, we just keep these questions to ourselves, right? But honestly, having curiosity about your own body is simply the very first step to being empowered about your health. We are talking about normal, fascinating human biology today.
So let's ground our discussion right in the science. The official medical term for this white or clear discharge is leukorrhea. And I want you to think of leukorrhea not just as, well, discharge, but as your body's built-in, highly effective self-cleaning oven. It is quite literally the vagina's way of cleaning itself and maintaining this perfectly healthy, self-regulated balance. It's not a flaw, it's not a nuisance, it is an incredible biological mechanism doing exactly what it's wonderfully designed to do.
And this self-cleaning mechanism isn't just stuck on one setting. It's completely natural for discharge levels to fluctuate during specific life stages and massive hormonal shifts. Things like ovulation, the incredible journey of pregnancy, going through puberty, or just general hormonal changes can all cause a really noticeable increase in leukorrhea. These aren't red flags, guys. They are simply normal, biological indicators that your body's natural hormones are hard at work, shifting and adjusting exactly as they're meant to. And this brilliantly illustrates the exact difference between a healthy baseline and when you should perhaps pay a bit more attention. Your healthy baseline is typically clear or milky white, completely odor-free and, importantly, pain-free. But the moment that shifts to yellow, green, or gray, or brings along a really strong, unpleasant smell or itching, well, that is your body waving a caution flag. Memorizing this contrast is a super vital tool for your personal health toolkit. When you're trying to decode these warning signs, it really helps to look for two distinct types of clues: visual and physical. Visually, you're on the lookout for that yellow, green, or gray color change we just talked about. Physically, you're checking for a strong, unpleasant smell or any brand new feelings of itching, burning, pain, or even a fever. By separating them into visual and physical clues like this, you know exactly what to look for and exactly what to feel for, leaving absolutely no room for guesswork. So the crucial point is this: if you do happen to spot those specific visual or physical deviations from your normal baseline, it's just your body's highly intelligent way of sending you an alert. These warning signs are definitive signals of a potential infection. It is absolutely nothing to panic about, for sure, but it is your body communicating that its internal ecosystem is kind of off balance and just needs a little bit of extra support and professional medical attention. When that healthy balance gets disrupted and those symptoms pop up, we're usually looking at a few common culprits. It's often yeast infections, bacterial vaginosis, which we commonly call BV, or certain sexually transmitted infections. But remember, you do not have to play detective here and figure this out all on your own. A healthcare professional can easily identify the exact underlying cause and recommend the precise treatment plan to get your internal ecosystem back to its normal, thriving balance. So how do we proactively support our body's natural defenses on the regular? It really comes down to clear, actionable, everyday preventative habits. Opt for breathable cotton underwear to keep things nice and aerated. Keep the genital area clean and dry. It's also vital to avoid scented feminine products. Because remember that self-cleaning mechanism we highlighted earlier? Yeah, scented products completely disrupt that delicate natural balance. And finally, practicing safer sex is a key preventative measure. These are just straightforward daily habits that actively protect you. But look, even with the absolute best daily habits, sometimes you just need to call in a pro. There are explicit red light triggers for when it is absolutely time to see a healthcare provider. If your symptoms persist over time, if they're getting worse, or if they just keep coming back after you thought they were completely gone, it is time to make an appointment. Furthermore, if your symptoms are ever accompanied by severe pain, a fever, or any unexpected bleeding, do not wait. Getting an early diagnosis is absolutely the best way to resolve the issue quickly and prevent any further complications. If there is literally one thing you take away from this explainer today, let it be this: not all vaginal discharge is a problem. In fact, as we've learned, most of it is a sign of a vibrant, healthy, and properly functioning body. Knowing what's normal for your unique self and having the tools to recognize those specific warning signs is simply the most effective way to protect your overall health and well-being. Which brings us to a final, somewhat provocative thought to wrap up today's explainer. Are you actually listening to the signals your body is sending you? Our bodies are incredible machines that constantly communicate with us, provided we actually know how to listen. So stay curious, tune in to your own bodily health, and I'll catch you in the next explainer.